We're back with the 7 secret causes of nerve pain that your healthcare. We're back with the 7 secret causes of nerve pain that your healthcare provider doesn't want you to know about. Because if you knew about these 7 secret causes of nerve pain and how to get rid of them, then you'd no longer have the nerve pain anymore, and you would no longer need that healthcare provider's help. And they want you to need their help because they need to, pay their bills and whatnot, which makes sense. So on the last video, we had Yvette here who was describing to us her nerve pain, and we'd asked her, well, we were beginning to ask her about the 7 secret causes: ileocecal valve, valves of Houston, blood sugar, rib torque, protein utilization, and then checking the psoas muscles. You guys remember this from the last couple videos? And it just turns out that her psoas muscles were not locking in place. And then when she lied down on her back, and she, go ahead and lie down on your back, and she pushed up her legs into my hand when I put my hand here to stabilize her, push, push. Okay, that's another circuit, and those muscles didn't quite lock in place. Okay. So Yvette, has any healthcare provider of any sort ever done those 7 tests with you?
No.
No.
And I visit a lot of health provider, orthopedic, neurological doctors, physiatric, and rheumatological doctor, and even as surgery doctor.
Wow, that's quite a few doctors. That's crazy.
Yes.
Do you think, I didn't ask Yvette about this ahead of time, but do you think it would be all right with you? You can say no anytime, but if we checked a few other things that we could check for nerve pain that you haven't yet gone over, you'll keep your clothes on and everything. Don't worry. But
sure.
yeah, if you don't like it, we'll stop. But
That's okay.
okay. So just gonna make sure we don't get too carried away here. So the one thing that's a good idea to look at is to look at a person's skin tone. So sometimes people have trouble with their gallbladder or liver, and they have a palm that's not the right color. So, that's something that a healthcare provider with the right training could check. It seems like a good idea to me. And then, have I ever helped you with any kind of nerve pain? Do you have those pains and aches now that you were describing?
Yes.
You still have those?
No, I don't have it.
Okay.
Sorry, I misunderstood.
Yvette's English is not Yvette's first language, but she's doing really well, as you could hear first her speak English. I wish you could tell her, but okay. So we can look at the palms. We can also look at the feet. Okay, so those are 2 things we can look at. And in traditional Chinese medicine, and in Western medicine, and in other areas of holistic medicine. Holistic means complementary and alternative medicine. Holistic means integrative medicine. Holistic means functional medicine. Holistic means naturopathic medicine. It's not the exact same thing. I mean, there's nuances of difference, but I'm certainly generalizing. Okay. So in these areas, we can look at the eyes. We can look around the eyes. We can look at the center of the eye. The center of the eye and the eye white is mostly related to the kidneys, and the area underneath the eye and around the eye is mostly related to the liver. So, and there's a lot of training. There's entire sciences based upon the eyes. There's iridology, for example, which looks at the ways of diagnosing people by looking at their eyes. And yeah, that's the main profession that comes to mind. The main science is iridology. Okay. We can also look at the person's nails and the health of their nails. Some people have these clubbed nails that curve a lot. That means they have a heart condition. They pretty much have heart disease, whether their blood pressure is imbalanced or not. And so we can look at a person's facial construction. In other words, we can look at their the contours of their face. We can look at their complexion. We can look at how they stand, how they walk. We can look at how they sit, how they swallow. We can watch how they breathe. We can find out about their hair quality. For example, people who have trouble with their thyroid tend to have a thin outer 1/3 of their eyebrows. And when they have They also tend to have thinning hair, so don't look at my eyebrows too much, but they could be a little thicker on the outer 1/3. So there's all these things that a person can look at if they have the right training. We can also look at a person's tongue. Let me see your tongue. I'll walk the camera for you if you want. No, let's see your tongue real quick. Just stick out your tongue. Yeah. So we can look at the shape of the tongue. We can look at the color of the tongue. We can look at every aspect of the tongue. So for instance, in the past, I've had a great deal of trouble with my digestion personally. So I used to have a lot of cracks in my tongue. Those were due to B vitamin deficiencies. Nowadays I don't have the cracks, but I have a little bit of ridging on the sides of my tongue, which has to do with chronic trouble with digestion, especially the pancreas, it just so happens. So there's actually entire books that go over the tongue and diagnosing tongue conditions, which is interesting. I was just looking in the office to see if we had a book here about that. So I hope this has been helpful. It's too bad the healthcare providers do any of the things
No, and I spent
that I just mentioned.
And I spent a lot of money.
You mean they didn't even check the traditional Chinese medicine pulse points? They didn't check your palms and the soles of your feet? They didn't stare at your face and kind of notice your hair and pay attention to your skin tone, or watch you walk around a room, or pay attention to how you sat and how you stood and whether you were breathing a certain way, or...
I guess, as you say, they were just treating my symptoms, but not the cause of the symptoms.
Okay. Well, we want to look at the whole body. It's all connected. The nerves are connected to bones and joints and ligaments. They're not really connected to hair. They're not connected to everything, but they're connected to almost every part of the body, more or less. And they're connected to the roots of the hair, because you have pain if you pull your hair, right? So you know there's nerve cells there. They're connected to the skin. They're just not connected to the shaft. That doesn't hurt, does it?
Yeah.
Okay. So thank you so much, and we'll see you. We look forward to seeing you soon. You're going to learn about our ways that you can find out about our office and how we can help you just below here, near where this video is. So thank you.